Hi, my name is Melannie Teitsma. I am a student nurse in Skills 2, Section KO4, here to demonstrate my medication administration part 2. So today is February 7th, 2021, and it is 16:35. So I'm going to administer the scheduled medications, and I'm going to start by comparing my doctor's order with my MARN. Jake Nursing, 312-312-654-654-987-987, January 1st, 1960, January 1st, 1960, Dr. Skills Lab, and there's no known allergies, but we'll double check that at the bedside. Ondansetron, 6 milligrams, intramuscular, daily, before supper, and it's signed off twice, off twice, given every day at 1700 hours, which is before supper, so that's a medication we could give. Heparin, 5,000 units, subcutaneous, daily, signed off twice, given once daily at 0800 hours, and so this is a medication we could also give. Since it's 16:35, I'm only going to administer the ondansetron since we're within that half an hour time frame of 1700 hours. My patient was admitted for uncontrolled nausea and vomiting secondary to chemotherapy, and ondansetron is a very common antiemetic to use in these situations. So I'm going to put aside my physician's order sheet, and I'm going to select out the correct medication. So we've got ondansetron, which is 2 milligrams per milliliter, so we're going to be drawing up 3 milliliters, and it is a single-use vial, so we're going to be discarding this later, and it is not expired, so we can give that. So now I'm going to double check with my drug monograph. I see that ondansetron is an antiemetic that can be administered by a student nurse, and for generally chemotherapy, nausea, and vomiting, you can give around 4 to 8, generally 8 milligrams intramuscularly every 8 to 12 hours. Generally, it's actually given IV, so I would ask the physician why we chose to give intramuscular in this specific case. And so now we are going to, and so since 6 milligrams every 24 hours is within that safe dosage, we are going to be giving this medication. So I can set this aside.
You can have a cat. You can have a card and money.
Oh, I love money. Okay, so now I'm going to select out the correct syringes. So I've chosen to use a 3 ml Lurlock syringe. I can draw up 3 milliliters accurately. And I've also chosen a syringe that is 22 gauge with a 1.5 inch needle, so that falls within our parameters for intramuscular, and we are going to be giving it in the ventrogluteal. So this is a very safe medication to use in this scenario. So now that I have my correct things, I'm going to wash the top of my vial for 30 seconds in a circular motion. Don't put that on your ear. Put it back. Okay. And now that I've done that for 30 seconds, I am going to take my blunt fill needle, which is not a filter needle because we're only drawing it from a vial. And I'm going to take my 3 ml syringe, and I'm going to connect the two without contaminating the hub. And now I'm going to draw the plunger back and forth without contaminating the plunger itself, just to make sure there will be no resistance. And I'm going to draw up 3 milliliters of air, safely uncap, inject straight down, and insert my air. Then I'm going to flip, and I'm going to withdraw 3 milliliters of medication without contaminating the plunger. Hello.
It's not here. It's just saying, what is it?
This is a lot of medication to draw up. Okay, just gonna keep drawing back there. How did he learn the word monsieur?
Monsieur. He's
3 years old. Okay.
Monsieur.
Alright, so now we've drawn up enough medication, so I'm going to take this off. Recap utilizing the scoop method. Pull back. Take out any bubbles.
Poor thing.
I know I'm whacking it so much, eh? Recalibrate. And we've got a little more than 3 milliliters just so that when we transfer needles, nothing bad will happen. We won't lose any medication. So I'm going to draw back now. I'm going to disconnect my blunt fill. And I'm going to connect my needle without contaminating the hubs. So now I'm going to recalibrate that dose. And I see a blip, but I see that we still have a little bit extra, so I'm going to utilize my med waste. And I've got exactly 3 milliliters. So now I'm going to recap using the scoop method. And so I see that I have exactly 3 milliliters drawn up, and I have a bleb at the top, so it is primed. And so this is the accurate dose. So now I'm going to create my label. So Jake Nursing, correct drug is ondansetron intramuscular. Correct dose is 6 milligrams, which is a volume of 3 milliliters. Correct time is February 7th, 2021, and it's 16:40 right now. And my name is Melannie Teitsma, Manitoba student nurse, and I am authorized to give this medication. So now we're going to label it right away without getting in the way of the numbers. And so now we're going to do our second check, where we are double checking the MAR with the medication bottle, with the medication itself and its label. So correct patient is Jake Nursing, Jake Nursing. Correct drug is ondansetron, ondansetron, ondansetron. Correct dose is 6 milligrams. We've got 2 milligrams per milliliter, so we drew up 6 milligrams in 3 milliliters, and I see that we have exactly 3 milliliters with no bubbles. So that's the correct dose. Correct route, it's intramuscular. We chose a 22 gauge, 1.5 inch needle, so this is a good, it fits within the intramuscular parameters, and we're going to be giving it in the ventrogluteal, so that's a very good needle to choose. And correct time is 1700 hours. Right now it's about 16:40, so we are within the half an hour boundaries and we can administer this medication. So now I'm going to discard my medication because it is a single dose vial, and I'm going to take my MAR, my medication, a pair of gloves, a cotton swab, an alcohol swab, and a pen to my patient bedroom. And I'm going to enter my patient bedroom and I'm going to introduce myself. Hi, my name is Melannie Teitsma. I'm your student nurse for today, and I'm here to administer your ondansetron injection. So as I'm entering the room, I am double checking that there's no hazards on the floor and that the patient is in a safe, comfortable position. Their call bell is within reach and their bed's at an appropriate height. So now that I've done my entrance safety check and introduced myself, I'm going to go down to the bedside, and I'm going to confirm the patient's identity. So I'm going to ask them to state their name while comparing it with their wristband and with the MAR. So can I ask, what is your name?
Jake Nursing.
Jake Nursing. And when were you born?
January the 1st, 1960.
January the 1st, 1960. And the FIN, 312-312-654-604-9797. And the doctor is Dr. Skillslab, Dr. Skillslab. And Jake, do you have any allergies?
No.
My patient has no allergies, and so I know this is the correct patient. So Jake, I'm going to do my final check up at the top of your bed, and then I'll come down to you. Does that sound good? Okay, so I'm doing my final check here where I'm comparing my label and the MAR. So we've got correct patient, Jake Nursing, Jake Nursing, Jake Nursing. Correct drug is ondansetron. This is ondansetron. Correct dose is 6 milligrams. It's 2 milligrams per milliliter, so we drew up exactly 3 milliliters with no bubbles, and we primed the needle, and I see that I have exactly 3 milliliters. Correct route is given intramuscularly. We have a 22 gauge needle with a 1.5 inch syringe, so that is a really good one to give intramuscularly. And correct time is 1700 hours, and right now it's about 16:45, so we're within the half an hour window, so we can give this medication. So I've done my final check, so I'm going to, hey, can you get those out of here a little bit? Thank you. So now I am going to talk to my patient about the medication. So hi, I'm Jake today. I'm here to administer your ondansetron. And so ondansetron is a common antiemetic, just to prevent the nausea and vomiting you've been experiencing with chemotherapy. We've already tested that you have no contraindications to this drug, and I've already done some assessments. I checked your vitals to make sure they're stable, and we've been monitoring your lights as needed and doing ECGs as needed as well. And everything looks okay, so we are clear to give the drug. So some side effects of this drug include dizziness, or like a headache, and constipation, as well as irritation around the injection site. So we're going to be giving it in your ventrogluteal. So if you feel anything that you think might be a side effect, please let us know. So I've chosen to do the ventrogluteal, so I'm just going to landmark. So I'm going to map out the top of the femur, the greater trochanter. I'm going to take my 4 fingers, feel out the iliac spine, and make sure that my thumb is pointing towards the groin. Separate my fingers and poke in right there. And that way we have the correct ventrogluteal location. So now that I have explained the medication to my patient and they verbalize understanding of the medication, I am going to actually administer it. So I'm just going to take you down. Please don't fall, please don't fall, please don't fall. And I'm going to take my area and clean it in a circular motion for 30 seconds. And it has now been 30 seconds. And I'm going to put on my gloves. I normally only wear gloves if I'm in contact with medication or bodily fluids. So I like to put them on afterwards just so I won't have any slipping happening. So with intramuscular, we always want to Z-track and give it a 90-degree angle. So that's exactly what I'm going to do. I'm going to safely uncap, Z-track at my location, inject. Oh, Mark, move, move, move. Stabilize, inject fully. And I'm going to hold it for a few seconds, unstabilize, off, off. And so now I'm going to recap utilizing the scoop method, as you can see. Oh no, I'm not going to recap, I'm going to activate the safety, sorry. And I'm going to put it in the sharps. Sorry, long warning. And I'm going to discard that. So now that I have administered the medication, I normally like to give my patient a cotton swab just to press on there and make sure they're doing okay and remind them not to massage the site. And so now I'm going to take my MAR and I'm going to sign it. So my name, Melannie Teitsma, designation, UMETO with student nurse. The time is 1700 hours. So we are signing it and so it is documented. So now I'm going to talk to my patient a little bit. And I'm going to tell them that we're going to be monitoring their nausea and vomiting and see how that's going. And we're also going to be monitoring your vital signs and doing some blood work as needed. And so if you need anything, your call bell is within reach. And I note that your bed is at an appropriate height, you're looking safe and comfortable, and that you understand the procedure. And there's no hazards. So now that everything is okay and I've verbalized every assessment I need to do, and I'm going to go leave the room and I'm going to document my the assessments that I did in my nursing book. So thank you for your time. Have a good day.